Good afternoon. I'm Dr. Karan Johar, coming to you from New York City. I wanted to take a moment to clean my surfaces over here, remove my mask, so we're all safe and taking precautions for COVID. I wanted to take a moment to thank the Nevro Corporation for collaborating on our presentation on HF-10 innovation. So let's begin. All right, so a little bit about me. So I'm a pain management doctor. What does that mean? So I'm board certified in physical medicine and rehabilitation, as well as board certified in pain medicine. I completed um, my intern year at Stony Brook University, followed by my residency at Washington University in St. Louis, and then completed a fellowship in pain management at the Medical College of Wisconsin. Afterwards, I returned here to New York City. So here in New York, I play several roles. I'm an assistant professor at New York University, and I also serve as the medical director of New York City Pain Specialists, and I'm an attending physician at the NYU Langone Hospital System, as well as the Lenox Hill Hospital. I also serve on the board as chairman for the New York Physician Society, and I've been nominated as the Castle Connolly New York Magazine Top Doctor in Pain Medicine category 2015 through 2020. So I appreciate that. All right, so a little bit about my practice. So we are located on the Upper East Side of New York City in Manhattan on 993 Park Avenue. And we offer a multidisciplinary approach to complex pain. What does that mean? So one can treat pain by looking into a less invasive situation towards a more invasive situation. So what does that mean? So I think that a doctor and a patient work essentially as a team to address their medical issues, and in this situation, their pain. So engaging a patient with education, I think, is the most important so that one is able to ascertain what components are contributing towards their overall pain and how we can targetedly treat each of those components. So oftentimes, patients can participate in physician-guided home exercises, physical therapy, oral medications, topical medications, and also interventional procedures. Some of these interventional procedures are minimally invasive, which means utilizing a needle or very small openings underneath the skin to access areas in the spine or various joints to provide pain relief. And most interventional, I would say, would be major surgeries. So here we treat cancer pain, neurological pain, musculoskeletal pain, using a combination of the medications, nerve blocks, intrathecal drug delivery systems, spinal cord stimulation, which we're going to talk a little bit more about today, radiofrequency techniques, regenerative medicine, and other types of neurolytic blocks. So here in our clinic, we also have a facility that is accredited by New York State to perform surgery. So it is a Quad ASF accredited facility, and there are a limited number of such facilities in New York State, and we're able to provide procedures with or without general anesthesia to make sure that our patients are safe during any of these minimally invasive procedures that we perform. So I wanted to also mention that this presentation is in collaboration with Nevro Corporation, and it is jointly conducted by, and all related materials are developed in collaboration with the Nevro Corporation, the maker of HF-10. All right, so let's begin. So a little note on COVID. As you noticed, I had my mask on before we started. It's very important to mask up and maintain social distance so we can protect each other with and from COVID-19. Fortunately, it seems that with the recent release of the COVID-19 vaccine, it seems that there's light at the end of the tunnel, and hopefully the end of 2020 and beginning of 2021 can be an optimistic and healthy one for all of us. So anyway, with COVID-19, how are we keeping you safe? Your safety, our staff safety, and the community safety is our top priority. So we have telemedicine consultations that are utilized when appropriate. We have office protocols in advance of your visit where we will talk to you, answer any questions. Also, we will screen patients before they come in to make sure no one is sick or possibly infectious. And all of the paperwork can be completed touchless or electronically prior to the visit. Our new office protocols require masks for all patients, physicians, and staff. There are plexiglass shields in various areas of the office where you may be speaking to the front desk, etc. We have temperature checks, which are performed for all patients, all physician, and all staff each day, as well as a screening questionnaire upon check-in. Our waiting room capacity, the number of seats has been reduced, and there are visual distancing markers that are placed on the ground so that people are able to be reminded to keep their social distance. Additionally, if you would like to wait in your car, we can text notify you that you're ready to be seen. So again, important to keep safe. All right, so let's talk a little bit about pain. What is pain? So the International Association of the Study of Pain defines pain as something that is sensory or perceived, actual or potential perception to tissue damage that can cause feelings that are, or sensations that are sent to the brain via various nerve pathways. Then the way your brain interprets this information can be affected by so many different factors, including psychological factors. And pain can differ enormously amongst different individuals. So what that means is someone may interpret pain in one way or define it, let's say quantify it as a 7 out of 10, and someone else could quantify that same painful stimuli as an 8 out of 10. And then again, this is based on past experiences, physical, mental, and emotional components. For example, if one had touched a hot stove and one has touched a hot stove before and injured themselves, their perception of pain, they may anticipate that pain, and the pain signals will be interpreted in the brain differently than someone who has never had that same experience. All right, so chronic pain is a pain that lasts longer than what is expected from that initial injury. Okay, so chronic pain is generally a pain that has been persistent for several months, despite treatment and various coping mechanisms or medications, etc. It can be caused by injury, infections, ongoing ailments, and we keep mentioning this psychological component of pain. There's definitely an emotional component, including depression, anger, or anxiety. Oftentimes, when someone is in chronic pain, this affects their everyday interactions at home, at work, in the community. So when one is able to alleviate some of this pain, patients are able to kind of view life from a different lens, and that can change their perception of pain. So chronic pain is actually an epidemic. Approximately 8% of the adult population suffers from chronic neuropathic pain. A majority of this is actually chronic low back pain. And this contributes to costing the economy in the United States approximately $600 billion per year. So chronic pain management, as we talked about, there are different options for treating chronic pain, from less invasive towards more invasive. So we had touched on pharmacological therapies. Various medications target different aspects of pain. For example, there are neuropathic medications which will target pain that comes from nerves. There may be anti-inflammatory medications that target musculoskeletal pain. There may be muscle relaxers that can be utilized from pain coming from stiff muscles. Asking patients to modify their lifestyle, such as eating better, watching their caloric intake, losing weight, that can affect the impact on each joint and reduce those forces and thereby end up decreasing pain in certain respects. Other treatments include engaging the patient in formal physical therapy or physician-guided home exercises. Goals include range of motion, stretching, strengthening, core strengthening, improving posture, and all of these contribute towards lessening certain forces which may be contributing to a repetitive microtrauma that causes or propagates pain. Additionally, you may see a pain management doctor or another doctor with a similar skill set, and they may utilize minimally invasive techniques such as nerve blocks, epidural injections, or other injections where you're basically taking a needle, either blind, which means without any sort of assistance, or utilizing fluoroscopic, or also known as X-ray guidance, or utilizing ultrasonic guidance to bring the needle to the source of the pain and delivering medications or delivering electrical energy to treat that area. Then we'll talk a little bit, we'll go into detail about spinal cord stimulation, okay? Additionally, options include surgery. So someone with unrelenting back pain or sciatica due to a herniated disc that does not resolve from some of the conservative management as listed above may undergo more invasive treatments such as a disc decompression or even something that's more invasive such as a spinal fusion utilizing hardware. Some patients that suffer from chronic pain may be prescribed opioid medications. Those that are on very high doses of opioid medications are also at risk for some of the things that go along with being on opioids. This can be a situation where they can be in danger of respiratory depression from being on very high doses of opioids, in addition to all of the addiction and other sorts of things that go with opioids. Those patients may benefit from having a intrathecal pain pump implanted, which delivers medication near the spinal cord in the intrathecal space. Spinal cord stimulation is a technology that utilizes electrical impulses that are placed behind the spinal cord and that change the brain's perception of this pain. And we'll talk a little bit more about that. All right, so what is spinal cord stimulation? So it's a safe therapy that involves delivery of energy. We had talked about electrical energy to the spinal cord through tiny wires in the lumbar spine or the back. So these small electrical impulses impact those pain sensing pathways of the spinal cord, effectively altering the pain signals traveling to the brain. So is this a brand new technology? Well, fairly. I mean, spinal cord stimulation was first developed as a therapy in the 1970s, and it has evolved significantly. So spinal cord stimulation can be used for several diagnoses that have been approved by the FDA. Some of them include pain in the lumbar spine or the back, pain in the trunk, and also pain in the limbs. So let's explore that a little more. So here we have a video. Okay, here we go.
A breakthrough treatment for chronic back pain and leg pain is here. It's HF-10, a spinal cord stimulation, or SCS, treatment option. It's FDA approved, and a clinical study demonstrated that it gives more people superior relief of both back pain and leg pain. Even people who have tried surgery and other pain treatments in the past are good candidates for HF-10. In fact, 8 out of 10 people who used HF-10 for severe back pain and leg pain experienced a significant reduction in pain, allowing most people to return to everyday activities. With chronic pain, abnormal pain signals are sent through the spinal cord to the brain. HF-10 calms the nerves that carry these signals to provide lasting pain relief. In a simple procedure, Thin, insulated wires are placed in the back near the spinal cord and connected to a compact, battery-powered pulse generator, which is implanted just under the skin. HF-10 sends mild electrical pulses to the spinal cord to calm the nerves, returning them to a more normal state. The procedure is quick, minimally invasive, and may not require a hospital stay. You're free to use it 24 hours a day, including when you drive or sleep. The HF-10 trial lets you and your doctor assess its effectiveness in managing your pain before committing to the procedure. The two temporary wires are inserted in the back near the spinal cord and attached to a pulse generator you wear on your belt. 9 out of 10 people who try HF-10 stay with it. Ask your doctor if HF-10 is right for you.
All right, so we all take a moment to read the legal statements over here. Okay, so let's move on to the next slide. All right, so here we go. So what is HF-10 and how is it different? So, I mean, as we saw in the video, they do highlight that advanced spinal cord stimulator therapy has been shown to help with long-term pain relief, and controlled trials do show that approximately 80% of patients receive pain relief. So what is that pain relief defined as? So generally, pain relief is defined in a spinal cord stimulator trial as 50% reduction of pain with the visual analog scale, which is basically a 0 to 10 scale quantifying pain. This can also be measured by improvement in functional independence, such as what you're able to do at home, self-care, doing dishes, doing laundry, taking a walk, etc. So HF-10 or spinal cord stimulation has been very highly effective for both low back pain and leg pain. FDA has labeled the HF-10 as superior to other spinal cord stimulation due to increased pain relief. Why is this? So HF-10 utilizes a specific frequency of 10,000 hertz that is patented, which is significantly different from traditional spinal cord stimulation, which hovers around 2,000 to 3,000 hertz. So what does that do? So with other types of spinal cord stimulation or standard spinal cord stimulation, patients have to turn off the machine before they get into a vehicle and drive because they are able to feel the impulses going down into their leg if they have a spinal cord stimulator implanted in the lumbar spine. Here with HF-10, with the high frequency, the patient does not perceive those paresthesias or sensations going down their legs, and it's safe to be running while you're driving and sort of going about your everyday. So that's what this paresthesia-free technology, or this HF-10 or 10,000 hertz technology, is talking about. It creates a situation where one is able to have pain relief because the signals are manipulated in the lumbar spine and then interpreted differently in the brain. So you basically end up having a pain relief without feeling a sensation or tingling in the spine. So basically you can use this 24/7 when you sleep, while driving, etc. So let's talk a bit about the spinal cord stimulator. What are the parts and components over here? So we talked about the frequency programming at 10,000 hertz, which is a patented technology. And so is that stimulator also able to work at a lower frequency? Certainly, that stimulation can be programmed in the office for stimulation alone, or to be paired with HF-10 technology. Are you able to bring and go visit to have an MRI scan to get updated imaging for your lumbar spine for your doctor to interpret your your current status? Absolutely. So the Nevro spinal cord stimulator has been conditionally approved for a full body MRI. Additionally, so over here we see this, the gray pulse generator that says Nevro on it. You see that in the picture over there? So that's essentially a battery and a computer. Then the wires that you see are with these, that's blue, and then you see these contact points, which are in silver. So those contact points are where the electricity is emitted along the dorsal column of the spinal cord stimulator, or the back, dorsal column of the spinal cord, and or the back of the spinal cord, where those pulses are emitted and create a manipulation that results in the perceived reduction in pain. So additionally, here we have the rechargeable battery, which is a rapid recharge, and it comes with a 10-year battery life. So one is able to have this device in for 10 years. Then after 10 years, you have to come in and see the doctor, and we will explant or remove the old stimulator and implant a new one, which should keep you going for another 10 years, or if the technology improves, even longer. So clinical trials have demonstrated the HF-10 offers the highest success rate in helping patients return to everyday activities. And some of those we had talked about were activities of daily living. HF-10 has also achieved more pain relief in patients at 24 months out compared to traditional spinal cord stimulator. And this was seen through a multi-center randomized controlled pivotal trial, which was published in Neurosurgery back in 2016. So superior pain relief, more freedom, less burden. So we talked about there are no driving restrictions with Nevro's HF-10 compared to traditional spinal cord stimulation. You're able to sleep. You're able to get a good night's sleep without having to turn off the machine. And there's just a greater opportunity because of the improved battery life and rechargeable technology where it doesn't really interfere with your everyday situations. Other spinal cord stimulation or traditional spinal cord stimulation based on positional movements, if you bend or move in a certain way, that may create a situation, not always, where there may be a tingling or pricking or buzzing sensation that goes down your extremity. But that's really due to the lower threshold of the frequency that's being emitted from the stimulator. Here with HF-10 at 10,000 hertz, one does not feel any sort of paresthesias going down their leg. So all of this really couples towards a higher quality of living. So let's go over a couple of facts of how does the procedure work. So patient oftentimes has had pain for over 6 months, have tried a variety of modalities, including physical therapy, medications, possibly minimally invasive procedures, such as epidural injections in the spine, and they continue to have pain. Some patients may have even experienced undergoing a full spine surgery or spinal fusion and still continue to have pain. So patients like that may be candidates for a spinal cord stimulator trial. So patient will come in using a TUI needle or the same needle that's used for an epidural. We access the space in the spine using fluoroscopy or X-ray guidance and guide that needle tip into the epidural space. Once we are safely in the epidural space, that's confirmed by using different fluoroscopic views, AP and lateral views, to make sure that we are in the safe space. And then once we've assessed that, we will insert these wires, which are the leads for the spinal cord stimulator trial, into the patient. Okay, then we confirm that we are in a safe space again. And then we guide those wires up north, okay, and to a particular level in the spinal cord. And we don't need to do any sort of intraoperative testing where with traditional spinal cord stimulators, you are required to do that. So once you've reached the anatomical space or the level that you want to bring the leads to, we bandage the patient up. Okay, there are leads that are sticking out of the patient's back, and we cover that up with a special dressing. So then the patient goes home, usually for 4 to 7 days, or on this slide it says 5 to 7 days, where a patient monitors their pain and documents, okay, I got out of bed, or I went for a walk, or whatever their daily activities are, and what their level of pain is with the stimulator on. They may go through a series of different programs that are executed in the pulse generator, or that little computer, and the patient will notate what programs, what their pain perception is, and then they return to the doctor a few days later. Okay. At that time, we assess, did they have a 50% reduction in pain, or do they have any functional improvements? Are they able to do more than what they were able to do before? If that's the case, then that's considered a successful trial. At that point, we would remove those leads in the office, okay, and that's done at the bedside. And then the patient is deemed a candidate that was a successful trial. So let's just kind of go through the slide. So will the patient feel anything? No, I think we've hammered in this point that the paresthesias, or the buzzing sensation that one feels going down their extremity with traditional spinal cord stimulation, that's not an issue with HF-10 because of the 10,000 hertz patented technology that's utilized in Nevro's hardware. This is a trial, and the great thing about the trial, before you go and do something, before you go and get married, you want to date. Before you want to go and have a surgery or have a spinal cord stimulator, pulse generator, battery, and wire or lead placed inside you, you want to make sure that, hey, if I do this, is this going to help me? So absolutely, this trial is reversible. Those wires that go in can be easily removed. There's no permanent sequela that's as a result of that. What if you don't like what you're feeling? Are you able to turn off the machine? Absolutely. You as a patient have power to turn off the machine. You have a programmer that you're sent home with where you're able to exert control over that. And even during that time, you have full ability to contact your healthcare provider and also the clinical representative from the spinal cord stimulator device company. Can you have an MRI with the trial in place? That's accurate. So HF-10 permits full body MRI scans under certain conditions. You can find out more about that by visiting hf10.com. So here we have another video. Looks like getting back to things we love. And I look forward to opening restaurants in New York so we can get back to that. Governor Cuomo.
HF-10 has given me back. It's giving me back what I lost. It's given me back my life. I used to be a farmer. I worked on a farm 18 hours a day, 7 days a week. We were lifting hay, and I took a step and down I went. They had to fuse my back. As time went on, I took everything to help deal with that pain and anguish you're in. Epidurals, opiates, narcotics, and that's a bad trip. They taught you everything on how to control the pain because they couldn't fix the pain. I've always loved working with wood. And before HF-10, it was getting to where it was a chore. I just couldn't stand there and work on the tools. If you carried 100 pounds for 5 blocks and then you put it down and walked, you get that big sense of relief and your body actually feels light as a feather. All I could think of is now I can go back to doing things that I enjoy. But we like to travel and it allows me to do it again. We could go on the trips we want to go on. I went from being a very energetic, hardworking individual to not being able to do any of it. Because of HF-10, I got it back. I lost it, I have it. And I never want to lose it again.
All right, very nice. Let's go to the next slide. All right, so here we have patient Freer, and he had certain desires and motivations, just like we all do in life. What is it to live life? It's not just to exist; it's to do what it is that you love, whether it's playing with your grandkids, your children, taking a walk, playing tennis, um, running around the Jackie Onassis Lake in Central Park, traveling, or farming as this individual. So after trying multiple therapies, including medications such as opioids that have significant side effects, um, trying various injections, this patient was able to go this procedure where they had a trial of HF-10 and eventually underwent an implant and ended up were able to get their life back. Or, as we have a motto here at NYC Pain Specialists, and that's to bring life back to your years. And that's something I truly believe in. I mean, that it's one thing to prolong the length of life, but it's another thing to live and to be human. And I think that's what everybody really wants. So, this slide I think just has um, some patients which were able to get back to what it is that they love to do. So, what do you love to do? And why can't you do that? You can do anything that you want to do. And I think that's what it is to be a New Yorker. That's what it is to be an American. And that's what it is to be a human being. And everyone has rights to be able to live life to the fullest and be able to get back to doing what it is that they were loving to do or enjoying to do. So chronic pain is a common issue for many people in both the United States population and worldwide population. There are many different treatments that are out there, including spinal cord stimulation, which we highlighted today. High frequency 10 or HF-10 stimulation allows patients for pain relief without paresthesias or tingling that's seen in traditional spinal cord stimulation. So if you'd like to learn more, certainly call my office or reach out to my colleague, Scott Lenahan, at scott.lenahan@nevro.com or visit hf10.com to learn a bit more. And I wanted to thank everybody for taking out time today to listen to our little talk, and hope you have a wonderful holiday season and Happy New Year. And remember to stay safe. We're all in this together. Take care. Thank you.